I'm going to give an overview of the Maltese situation on the recognition of the specialist nurses and midwives in Malta, and this is we are quite young in this endeavor. So I'm going to give an overview of this. So although nursing has been around in Malta since the Middle Ages, it was only after the introduction of nursing legislation in 1936 and the setting up of various educational initiatives at the end of the 19th century that has seen nursing evolve into a profession, so much so that such autonomous recognition came in 2003, and the granting of a professional warrant later on in 2009. Specialization is a relatively recent development. The first call for infection control nurses was published in 1994. This step, however, gave impetus for other areas in specialization to emerge. In fact, in 2002, calls for 3 posts of breast care and 6 posts for practice development nurses and midwife were issued. Although the number of posts seemed small, they were relatively adequate in relation to our small nation at that time. Changes in practice due to increased technology and complex medicine raised the necessity of legislating such practice, and on the 24th of November 2003, the Healthcare Professions Act was enacted in Maltese Parliament, which legislation served as an important instrument for acknowledging the concept of professionalism and autonomy of all health professionals and the specialization thereof. This act was also important as it laid the ground for the laying down of the legal foundation for the provision of specialist training for nurses and midwives. It acted as an instrument for the training of specialist nurses to learn their role and anchor their status within the profession. The use of the term specialist was then thus regulated by law, and no one could make use of that term unless one is registered as a specialist. In 2008, this issue gave rise to a dispute over the terminology of specialist for nurses, because the specialist register was still not set up. This issue was temporarily settled with the 2013 sectoral agreement between the government and the Union of Nurses and Midwives, where the nomenclature of specialist nurse or midwife was changed to practice nurse or practice midwife, together with the development of a career pathway within the clinical branch, in parallel with that of the managerial branch. This was only meant to be a temporary stance in the preparation of the specialist framework for nurses and midwives. The Office of the Nursing Directorate was crucial in the conclusion of these agreements, which agreement led to the Healthcare Professions Act to be amended in 2019 through a legal notice in order to include a list of 18 nursing and 6 midwifery specializations. This facilitated the way for the introduction of the specialist registers, which will be regulated by the Specialist Accreditation Committee. As a proactive initiative, the Directorate helped set up the Postgraduate Training Committee with the main remit of developing pathways leading to the specific registers and to be presented to the Specialist Accreditation Committee for endorsement. My colleagues within the Directorate worked very hard to develop these pathways, as they entailed long hours of meetings with all stakeholders, including the union and the associations, plus hard negotiations to finalize an acceptable draft between them. This draft, in fact, was presented incidentally yesterday, where the Specialist Accreditation Committee met for the first time. So over a stretch of 1 year, with all the odds against them due to the COVID-19 situation, they managed to meet with all stakeholders to formulate a framework consisting of 3 possible pathways leading to nurses and midwives into these specialist registers. The first pathway is for those practice nurses who have enough years of experience and specific academia within their area of specialization, or were appointed practice nurses prior to the Healthcare Act of 2003. These will be recommended for grandfathering. The second pathway is for those practice nurses who have enough years of experience but may lack some academia or vice versa. They would need to enhance their clinical practice or academia and then will be prepared to enter the specialist registers. The third and final pathway is for those who apply for the posts of specialist nurses or midwives and would need to start the journey from scratch before they can enter into the registers. And this is an algorithm of the pathways, the different ways of going into the specialization. The first pathway is for those for grandfathering. The second pathway is for those who have experience and academia, but they still need to achieve their level of competencies. And the last one, the third pathway, is the pathway for those who enter into the specialization as trainees. So the proposed specialization postgraduate training framework for Malta is based upon 3 main pillars, being a professional qualification, having an academic component at EQF level 7 or above, that is relevant to the area of specialty, or a level 7 includes either a master's degree, a postgraduate diploma, or certificate, with the master's degree being at the highest level with level 7. And level 8 includes a PhD qualification. Professional experience with a number of years of training as an apprentice or trainee within the specialty. And last but not least, the professional competencies, that is the satisfaction of advanced practice competencies for that specialty. As I mentioned earlier, the third pathway is the most challenging as it raises the need to seek partners for holding the training in the different specializations. And these partners would need to be both local and foreign ones. With the present specialist roles stretching from one extreme position, where some of these roles are hardly recognized by other professions, to the other extreme, where these same professionals rely mostly on the roles of other practice nurses, we are also working on the formulation of a scope of specialist practice. This will aid in identifying the specific roles leading to responsibility and accountability, respectively. Moreover, this will enhance autonomy of specialist nurses and midwives and also help in the development of nurse midwife-led clinics, for which we already enjoy a few successful ones, especially in infection control, tissue viability, breast care, and breastfeeding. This is also complemented with a number of nurse and midwife-led screening programs, mainly routine mammography and colorectal screening. Our vision is set firstly to collaborate with various stakeholders towards reaching a consensus of minimum training framework across European countries to have a mutual recognition of specialist qualifications and recognition of specialties. And lastly, to build bridges with different countries, healthcare systems, and centers of excellence where there could be exchange of experiences between specialist nurses and midwives and training and apprentice opportunities. Our vision is also focused on having our own training premises comprising an establishment coordinating the necessary programs in liaison with these partners to cater for all the specialties, both present and future ones. We have arrived at a crossroads where our specialization future lies on how well we will lay these foundations. Thank you very much.